So if you're watching this video, you probably had an implant done. Now, what is an implant? The implant is going to replace the root structure of the tooth. Now, when we do an implant, for the most part, we're going to let you know whether or not that was a simple implant or a more complex implant. With a simple implant, you probably had a bone graft done in the past or about 3 to 4 months ago. Now, with a simple implant, what we do is we just create a small incision. I open up the tissue, I drill a few holes in a series of increasing width, and I take a couple x-rays along the way to make sure we're aimed in the right direction. At that point, the implant goes in, and I put a little cap over the top. So if you're looking in your mouth and you see a gold cap, that's not the implant. The implant is below the bone. The gold cap is just covering the top of the implant, so that's normal. At that point, we put a few sutures on each side of that implant, which is normal again. So for the first 3 days, I'd say it's very, very careful to relax, all right? So no running any marathons. You should just do some light walking, if anything. Diet needs to be very soft food, and chewing on the opposite side. Now, if I did an implant on both sides, right, you might be a little bit more out of luck, so you're gonna have to go more soft food diet, just like mac and cheese or soup. But for the most part, when we're doing implants, we choose to do it on the same side. So at that point, you're gonna be eating on the opposite side of your surgery. And we're gonna go back to those hearty foods again, like we had when we were kids. So mac and cheese, mashed potatoes, smoothies, yogurt, all of those. I wouldn't have anything too hard or too sticky. Something too hard or too sticky could potentially dislodge the sutures that I had just put in there, so we do need to be careful. As far as medications go, you're going to be on an antibiotic, a steroid, as long as you don't have diabetes, ibuprofen or Tylenol, and most likely a pain med like a Vicodin or Tramadol. So the ones you do have to take are amoxicillin, or like your antibiotic, your ibuprofen or Tylenol. Those are the two that you have to take. The antibiotic is going to make the implant happy, and then the ibuprofen or the Tylenol is going to substantially decrease inflammation. So for the first 3 days, we want you to be taking those medications, or we want you to be taking the ibuprofen and Tylenol, especially for the first 3 days. The antibiotic you have to finish for the entire course, which is going to be about 7 days. The pain med is there for you if you need it, for the most part, but we're only going to be using that pain med if it creeps up to about a 4 out of 10 pain, where you're really starting to get a little bit more than dull and achy. Now, the pain should be going down around day 4, right? Now, around day 4, things just get better. It's going to be kind of dull, achy pain for the first 3 days. It's usually quite substantially less than what your extraction was, which is good news. Now, more of a complex implant. If we did more of a complex implant, that means that we probably took a tooth out and we put an implant in at the same time, or we placed multiple implants next to each other, or I placed an implant and I did a sinus lift at the same time. Now, when it's a little bit more complex, it's going to be all more important to really be on that soft food diet and follow the medications exactly how we prescribe them. If you forget, don't worry. Half the stuff that we say or explain, we don't expect you to remember. So you can give us a call and ask for us to repeat that for you. Now, with complex implants, they typically will involve taking a tooth out and placing bone graft at the same time, right? So once you take a tooth out, implant's going to go in, we pack bone around it, then I'm going to place a cover over the top of the implant, and then as well as more sutures. That has to stay in there. So whether it's simple or complex, the sutures will still all be removed around the 2-week mark. At that point, we're going to evaluate the area, make sure that you are healing on track, and then we're going to remove the sutures. If you have a membrane in place, which is a white cover, that's going to stay in for the first 4 weeks. At that point, we're going to remove that membrane. Now, with implants will go into the bone, so typically they're going to be very strong. When I put that gold cap on top of the implant, that means that the implant was very strong or the bone was just very good. So typically we're going to start the process of making you a new tooth around the 10 to 12 week mark, so it's going to be pretty fast. So that about wraps it up for what to do for whether you had a simple implant or a complex implant. Mainly 99% of people heal perfectly fine. So we'll be happy to see you in 2 weeks to remove those sutures, and we'll let you know what the next steps are.